Good Governance webinar series on 30th September 2022. It is my immense pleasure to extend a warm and hearty welcome to His Excellency Mr. Loh Kum Yeen, the Permanent Secretary of the Public Services Division in the Prime Minister's Office of the Government of Singapore, and also the Permanent Secretary in charge of the Ministry of Law. I'd also extend a very warm and hearty welcome to the Singapore delegation who is joining us today, Mr. Jeremy Yu, the Government Experience Officer, Service SG. He handles citizen-centric public services. Mr. Christopher Pragasam, Director Leadership Program and International Relations. Ms. Sim Su Lin, the Lead Analyst for International Relations and Public Sector Transformation. From the Government of India side, extend a warm welcome to Shri Bharat Lal, the newly appointed Director General of the National Centre for Good Governance, Shri NBS Rajput, the Joint Secretary in the Department of Administrative Reforms and Public Grievances, Professor Poonam Singh, the Faculty in charge of Administration in the National Centre for Good Governance. Distinguished colleagues, I would also like to welcome our two eminent speakers for the day, Shri Dharmendra, the Chief Secretary, Government of Arunachal Pradesh, former Chairperson of the New Delhi Municipal Corporation, and Srimati Deepthi Kanade, the Director Budget, Department of Space, Government of India. They would be presenting on two of the Prime Minister's award-winning nominations under the scheme for PM's Awards for Excellence in Public Administration 2021. A very brief background on this subject. The DRPG has been mandated by the Honorable Prime Minister for jointly conducting the National Good Governance webinar series once every month on the last Friday of every month. And so far 5 such webinars have been held. Award-winning governance practices which have been proved to be replicable and sustainable are showcased by the team leaders who are invited as lead speakers to the webinar for presenting their initiative and experiences before participating audience. The purpose of the webinar is to highlight and disseminate best practices and sharing of experiences. Today's webinar is on the theme Public Service Delivery. Let me introduce Mr. Loh Kum Yeen to deliver before I invite him to deliver the inaugural address. His Excellency Mr. Loh Kum Yeen graduated from the Hitotsubashi University, Japan with a Bachelor of Economics degree. He also holds a Master's in Public Administration from Harvard University, United States. He started his career in Singapore Civil Service with the Ministry of Communications. He was appointed as the Permanent Secretary, Ministry of Manpower from October 2009 to April 2016, and as Permanent Secretary of the Ministry of Trade and Industry from May 2016 to March 2019. From April 2019, he has been appointed as the Permanent Secretary of the Public Services Division in the Prime Minister's Office and serves concurrently as the Permanent Secretary in the Ministry of Law from December 2019 to April 21. He has been reappointed as the Permanent Secretary, Ministry of Law on 1st April 2022. So it is my great privilege to invite His Excellency Mr. Loh Kum Yeen to deliver the inaugural address at the 6th National Good Governance webinar series dated 30th September. Thank you very much.
Thank you. The Honorable Shri V. Srinivas, Secretary, Department of Administration, Reforms and Public Grievances, and Department of Pension and Pensioners' Welfare, Government of India, distinguished guests and participants from the Indian Civil Service. A very good afternoon to all of you. It is my great pleasure to be able to address you here at the National Good Governance Webinar Series 6 jointly organized by the Department of Administrative Reforms and Public Grievances and the National Center for Good Governance. It has been almost 3 years since I've been able to travel overseas to meet up with my valued friends and colleagues here in India. So I'm personally very happy to be here in Delhi today. The Public Service Division where I come from is a department under the Prime Minister's Office of Singapore that supports the development of the 150,000 strong public service workforce. As the central people agency of the Singapore Public Service, the PSD plays several concurrent roles. We are a driver for future-ready leadership in HR policies. We are a workforce developer, and we also act as a catalyst for public sector reform and transformation. Our aim is to collectively build a Singapore public service that is first class and ready for the future. The theme of today's webinar, Improving Public Service Delivery, is both important, timely, and one which resonates acutely with my colleagues and I. Whether in India or Singapore, we now operate in an increasingly complex and volatile world, exacerbated by the COVID-19 pandemic and various social, political tensions globally. As the public service, we cannot predict every change and preempt every problem. What we can do and must do is prepare ourselves to the best of our abilities to seize new growth opportunities and overcome the challenges that may emerge. In the past, we used to primarily engage with our citizens on site and assisted with their needs in person. That all changed when COVID-19 hit us. During the height of the pandemic, governments all around the world saw their services disrupted as social distancing and quarantine requirements kicked in. Many had to close their physical service centers in an effort to curb the spread of the virus. However, members of the public still expected governments to deliver services in an effective and timely manner. And notwithstanding our differences in size and scope, I believe this is a similar predicament experienced both in Singapore and India. While it was challenging to pivot so rapidly, we had no choice but to connect efforts across the public service to mount an effective response. Agencies could not work in their own silos, so working across the public service and organizing efforts around missions rather than agency boundaries became the norm rather than the exception. The impact to physical service delivery during the pandemic also meant that we had to ramp up our digitalization efforts to provide public services anytime, anywhere, and to everyone. All critical services that were previously administered physically, such as registering for marriages, were made available online and in a contactless manner. Many government services in Singapore were historically designed and delivered using an agency-centric approach rather than a citizen-centric approach. As a result, citizens' experiences with government were often fragmented, which left them sometimes confused and also frustrated. Transactions were often conducted independently, even if two or more services were needed by citizens at the same moment. Citizens also needed to navigate many digital and non-digital touchpoints to collect information and to complete transactions, which often required them to provide their personal information repeatedly to different government departments. So you could say that the COVID-19 pandemic provided us both an imperative and also an opportunity to reflect, to reimagine and to redesign a more efficient and a more effective way to deliver government services. And we have tried to lock in these gains in Singapore. At the Public Service Division, we have established a new team called Service Singapore, or Service SG in short. It is a team that aims to serve citizens with heart and with empathy by delivering government services in a more seamless and personalized way. By putting citizens at the heart of what we do, this also helps to bring different agencies together on whole of government missions so that the government can know and can serve our citizens as one. One good example of how we reorganize services around citizens is through our integrated public service centers. Piloted a couple of years ago, this is a physical center where citizens can come to a single location that has brought together over 20 government agencies. It brings a curated package of over 400 public services closer to our citizens' doorsteps, and they do not have to travel to different agency offices to complete government-related transactions. These centers have achieved very encouraging citizen satisfaction outcomes, with over 95% of respondents finding it easier to resolve their needs for public services. And riding on this wave of success, we've already launched another 4 integrated public service centers this year, plans to expand to 7 across the island of Singapore. As citizens ourselves, we too will all benefit from this expanded network of integrated public service centers. We are also making concerted efforts to invest in technology. As India, we see it as a key lever in how we can better deliver public services. With an increasingly technology-savvy public, we are digitalizing our services to the core so that citizens can access government services end-to-end online. We've designed a mobile app which we call Life Singapore, or Life SG, as a one-stop digital concierge for citizens to access key government services conveniently from their mobile phones. In doing so, we have sought to partner our citizens according to their needs as they journey through different stages of life, such as marriage, having children, preparing our kids for school, preparing adults for work, active aging, and even death. Life SG has bundled these related information and also services for each life stage to create a more personalized experience when citizens interact with the government of Singapore. Earlier in May this year, we also launched the new birth and death registration process. Next of kin can now download the digital death certificate from a portal, which we call My Legacy. 98% of the death certificates were downloaded digitally via My Legacy in the second quarter of this year. And for births, parents can download the digital birth certificate almost immediately upon successful registration. And over 9,000 births, quite a significant portion in the context of Singapore, have been successfully digitally registered as of August this year. Improvement to public service delivery is not confined to our citizens, but extends to our businesses as well. We have introduced a one-stop online portal where business owners can easily apply for different licenses that they may need by simply describing their business activities, and they no longer have to interact separately with different government agencies. In the process, of course, we had to take significant steps to redesign our services in a business or company-centric way. The improvements in the way we deliver public services would not be possible or sustainable without an effective and skilled workforce. These new ways of working to serve citizens and businesses need to be underpinned by new workforce mindsets and capabilities, such as having strong implementation skills and being able to partner with citizens and stakeholders. These skills, trust, and relationships can only be built over time by scaling up partnerships with the people and private sectors. To facilitate this growth and developmental mindset in our public offices, we have introduced various developmental initiatives, such as structured job rotations that allow officers to be attached internally to other government agencies or externally to private companies, something I understand the Indian civil service is also doing. I think this exposes our civil servants to new jobs, to new perspectives outside of their organizations, and helps them to learn new skills and also develop new networks. Lastly, just like how the Government of India has a scheme called the Prime Minister's Awards for Excellence in Public Administration to acknowledge, recognize, and reward extraordinary and innovative work, we too in the Singapore government have a similar initiative. We call this the Public Sector Transformation Awards. It is a whole-of-government platform to recognize public officers and public agencies for excellence and innovation in their work and organizational practices. We also look out for achievements that are sustainable and are reflective of underlying systemic changes rather than one-off efforts. The Public Sector Transformation Awards recognize efforts at 3 levels: at the whole-of-government level, at the agency level, and also at the individual contributor level. One of the main categories under the agency level is called the Service Delivery Excellence Award, which specially recognizes agencies for initiatives that demonstrated citizen centricity, service innovativeness, and a whole organization approach to service delivery, leading to significantly improved service outcomes. In conclusion, delivering public services is at the heart of what many, if not most, government agencies do. I observe many similarities between the priorities and the excellent work being done by the Indian and Singapore civil services. I think there's great opportunity for us to learn from one another in this important area of good governance and service delivery. I believe platforms like today's webinar help facilitate cross-sharing of best practices and innovative ideas. Once again, thank you very much for inviting me here today, and I look forward to hearing the 2 upcoming presentations from the awardees of the prestigious Prime Minister's Awards. Thank you very much.
On behalf of the Government of India, the Department of Administrative Reforms and Public Grievances, the National Centre for Good Governance, I'd like to thank His Excellency Mr. Lokhum Yin, the Permanent Secretary of the Public Services Division in the Prime Minister's Office, Government of Singapore, for delivering what has been truly a very memorable lecture, which is very comprehensive and extremely detailed. As he has rightly pointed out, our 2 nations share a common concept of bringing citizens and government closer using digital platforms. And yesterday in the joint working group also, we noticed the similarities between the Service SG platform and the CP Grams platform, which is operationalized currently in India. And we are happy to note that the Public Sector Transformation Awards have a category for Service Delivery and Excellence Award. Last year, the Honorable Prime Minister, after a presentation was made to him, introduced a category for improving service delivery without human interface as part of the Prime Minister's Awards for Excellence in Public Administration. So today we have 2 award winners. Let me introduce the award winners before we play the film of their awards and invite them to speak. The first awardee is Sri Dharmendra. He is currently the Chief Secretary of Government of Arunachal Pradesh. Sri Dharmendra is an IAS officer of 1989 batch of the Union Territories cadre. He has worked in senior positions in the cadre as well as in the central government. He has worked as Deputy Commissioner of East Delhi, North West Delhi, Commissioner Land Management, Delhi Development Authority, Development Commissioner of Daman, Diu, Dadra, Nagar Haveli, Secretary and Commissioner Industries, Government of Delhi, Secretary in several departments in the Government of Delhi, Joint Secretary in the Ministry of Housing and Urban Affairs, Additional Secretary in the Ministry of Consumer Affairs, Food and Public Distribution, Chairman of the New Delhi Municipal Council, and currently Chief Secretary, Government of Arunachal Pradesh. In his long and distinguished career, he has been awarded several times, but the most prestigious of which was the Prime Minister's Award for Excellence in Public Administration 2021 for the initiative NDMC 311 app of NDMC under the category End-to-End Delivery of Services Without Human Intervention. For all of us living in Delhi, this app has proved very, very useful, and I'm sure millions of Delhi citizens would thank him for this initiative. Our second speaker is Deepthi Aditya Kanade. She currently serves as Director of Budget in the Department of Space, Government of India in Bangalore. Srimati Deepthi Aditya Kanade is an IAS officer of 2008 batch of Karnataka cadre. She has worked in various capacities in Government of Karnataka as Deputy Secretary in the Department of Finance, Deputy Commissioner of Chikkabellapur District, Project Director, Human Resource Management System, and Director of the Electronic Delivery of Citizen Services, Government of Karnataka. Her work as Director, Electronic Delivery of Citizen Services resulted in digitalization of about 798 citizen-centric services through online platforms. She was awarded the Prime Minister's Award for Excellence in Public Administration 2021 for the initiative Seva Sindhu of Government of Karnataka in the category End-to-End Delivery of Services Without Human Intervention. So before I invite the speakers, we would play it before you a small clip of their contributions. The film may kindly be played.
There was satisfaction among the citizens about the information about NDMC public facilities and the time-bound action itself at the time of COVID-19. To the process of birth and death registration not being completely paperless and digital, the citizens faced a lot of trouble and also deprived of other services covered under the NDMC.
एमसी को स्मार्ट सिटी बनाने के पीछे हमारी सोच ये है कि जो हमारे रेजिडेंट हैं उसको किस तरह से सर्विस प्राप्त हो।
जो सर्विसेज एनडीएमसी ने शुरू की है, एक उनका ऐप भी शुरू किया 311 का भी, अगर कहीं गंदगी पड़ गया या आपको कोई कंप्लेंट करनी है, कोई इन्फोर्समेंट कंप्लेंट करनी है, उसके ऊपर आप कंप्लेंट कर दें और जो कंप्लेंट जाती है तो वो इमीडिएट सेम डे हो जाती है और उसका एक समाधान निकलने में ज़्यादा टाइम नहीं लगता।
नई दिल्ली नगरपालिका परिषद पूरे देश में संभवतः एकमात्र नगरपालिका परिषद है जिसने ब्लॉकचेन टेक्नोलॉजी को अडॉप्ट किया है और हमारे जो बर्थ और डेथ सर्टिफिकेट्स हैं उनको आज की डेट में हम अपने ब्लॉकचेन टेक्नोलॉजी के आधार पे डिस्ट्रीब्यूट कर रहे हैं।
एनडीएमसी ने ऐप शुरू किया जिसके थ्रू मुझे कहीं धक्के खाने नहीं पड़े। मैंने घर बैठे बैठे ऐप डाउनलोड किया अपने मोबाइल में 311 ऐप और उसके थ्रू मैंने बर्थ सर्टिफिकेट डाउनलोड किया।
एक एफिशिएंट गार्बेज डिस्पोजल, कलेक्शन, ट्रांसपोर्टेशन, मैनेजमेंट बिना टेक्नोलॉजी के संभव ही नहीं है। हमारी जो गार्बेज की कलेक्शन की व्हीकल्स हैं वो जीपीएस ट्रैक्ड होती हैं। हमारे गार्बेज बिन जब भर जाते हैं तो दे सेंड ए मैसेज कि दे आर फुल, दे आर नीड टू बी एम्प्टीड नाउ।
जो हमारे वाहन हैं उन वाहनों पे हमने RFID टैग लगा रखे हैं जो हमारे घरों पे जो टैग लगे हुए हैं उनको स्कैन करते हैं और उसके थ्रू हमारे कमांड सेंटर में इस बात की इन्फॉर्मेशन रहती है कि हमने कितने घरों को कंप्लीट किया है और कितने घर हमारे छूट गए हैं। उसके आधार पे हम फर्दर कार्रवाई करते हैं।
यहाँ पे गार्बेज कलेक्शन के लिए हर रोज़ सुबह वैन आती है और सेग्रीगेटेड कूड़ा पिकअप करके ले जाती है।
जो ऑनलाइन सर्विसेज हैं उनके लिए आपको किसी भी ऑफिस में आने की नीड नहीं है, किसी भी कंप्लेंट के लिए आपको आने की नीड नहीं है और उन कंप्लेंट की पूरी जानकारी, क्या समाधान हुआ, उसके फोटोग्राफ्स के साथ, जियो टैगिंग के साथ आपको उपलब्ध होता है।
कोई भी प्रॉपर्टी को या कोई भी लोकेशन को जियो टैग करते हैं, उस डेटा को अपने मैप पे प्लॉट करते हैं। हमारी जीआईएस की वेबसाइट है जहाँ पे हम उस डेटा को अपलोड करते हैं। अगर किसी ने टॉयलेट देखने हैं तो वो उस लोकेशन पे जाके अराउंड में जाके वो देखेगा कि मेरे विदिन 500 मीटर कितने पब्लिक टॉयलेट्स हैं। जैसे ही वो 500 मीटर का ऑप्शन चूज करेगा तो उसके चारों तरफ लोकेशन में जितने भी पब्लिक टॉयलेट्स अवेलेबल होंगे वो उसके सामने दिख जाएंगे।
हमने अपने यहाँ जो ऑनलाइन सर्विसेज प्रोवाइड की हैं लोगों को, उसमें इस बात का ध्यान रखा है कि कैसे मिनिमम ह्यूमन इंटरवेंशन हो और किस प्रकार से लोग उस सर्विस को बिना किसी फिजिकली प्रेजेंट हुए प्राप्त करें।
जिंदगी पहले से काफी आसान हो चुकी है,
काफी समय की बचत होती है। सभी नागरिकों के लिए
तो ये वरदान सिद्ध हुआ है।
ये जो सर्विसेज है इससे लोगों को बहुत सहूलियत मिल गई है और आम आदमी इसमें बहुत खुश है।
NDMC has made birth and death registration completely online. Due to this, today 1,000 to 15,000 certificates are printed online every month. There are online dashboards for all troubleshooting and tracking, where they can get complete information related to their problem. Online payment-enabled systems are also available for other services under NDMC.
Second film. This is the state of Karnataka.
Government of Karnataka was trying to simplify the facilities provided
now
to the
100%
citizens
digital.
and address the delays or complaints in a time-bound manner. The service provided by different offices should be integrated on a single plateau and form so that the inconvenience caused to the citizens is redressed immediately.
सेवा सिंधु शुरू हुआ था 2018 में एक सिंगल विंडो एजेंसी के तौर पर ये प्रोजेक्ट लॉन्च किया गया था। आइडिया ये है कि गवर्नमेंट के जितने भी सर्विसेज हैं, चाहे वो ग्रामीण लोगों के लिए हो, चाहे वो शहरी लोगों के लिए,
Very young lady.
एक ही जगह पे इकट्ठा एक ही प्लेटफॉर्म पर लाए जाएं।
10 years and she managed to make this happen. The software engineer.
All the services are to be delivered to the citizens' doorsteps in time limit.
We have reached almost 2 crore.
Having these webinars because the sharing means that other states can actually also learn and replicate.
Replication, dissemination and replication. And also the international speaker inspires them with the international experience.
roam around different offices and they need not travel far from their homes.
We used the Seva Sindhu platform to go one step ahead and reach a common man, a villager. That is, we started Grama One centers. Grama One centers are the franchisees with private companies, and Seva Sindhu is the technical platform which is used for delivering all the services under Grama One.
ऐसे कई जो आज भी अगर होगी जहाँ जाकर मैं मेरी सहायता करे और सारा जाए तो वो उसको प्रिफर करते हैं।
जाति प्रमाण पत्र, आधार कार्ड और अन्य सेवाएं सेवा सिंधु से हमें बिना किसी देरी और परेशानी के मिलती हैं। तालुका के अधिकारी खुद सेवा सिंधु की सेवाओं का निरीक्षण करने आते हैं।
Seva Sindhu has proved effective in this situation. Through this, end-to-end services were delivered without human intervention. 74 offices and 798 services were delivered digitally to the public through single windows. Today, more than 5,000 Seva Sindhu are working efficiently, and till now, more than 2 crore Seva has been successfully distributed.
It's my great privilege to invite Sri Dharmendra, the Chief Secretary, Government of Arunachal Pradesh, to kindly make his presentation. Sri Dharmendra, please.
Thank you, Mr. Srinivas, Secretary DAPRG. Am I audible?
Your volume is slightly low. If you could increase the volume.
Yeah, am I audible now, Srinivas?
Yes, we can hear you. Please continue.
Yeah. Mr. Srinivas, Secretary DAPRG, and Mr. Lokonian, Permanent Secretary, Public Service Division, Government of Singapore, and its team, DG, National Center for Good Governance,
Volume volume.
and other officials who have joined online from various districts. It's my proud privilege to present to you what was done in NDMC to improve public delivery system and to provide public services seamlessly to the public without human interface. To begin with, I would just give the background of the New Delhi Municipal Council. It's perhaps one of the old municipal councils in the country, and also the most important one because being located in the central Delhi, which houses the Prime Minister's house, President House, and all the parliament and all the member of parliaments, ministers, senior officials of the government of India. Though it's very small in area, with a resident population of 250,000, but it has a very large floating population of about 2 million per day. Density of population here is about 5,800 persons per square kilometer, and is also perhaps the greenest part of Delhi with 40%. The whole idea of digital municipal organization began with the initiative of the Honorable Prime Minister with an idea to provide government services to citizens electronically and create digitally literate citizens and eventually transform India into a digitally empowered economy. And several initiatives were taken by NDMC, which were technology driven to strengthen the e-governance and also the mobile government services to the people. It all started developing a citizen-centric web application and mobile application to minimize the physical contact with the citizen, developing the employee-friendly application for improving the work efficiency to make the web application and database more secure so as to ensure protection from the cyber attack. The services which are being provided by the NDMC can be categorized into 4 categories. The first category is government to citizen services. The second category is government to business. And third is government to the employees. And the fourth is a short-term application as per the requirement of the organization. If we see that government to citizen services are basically online birth and death certificate, online payment of utility bills, online name inclusion of a newborn, online booking of various infrastructure that is provided by NDMC for rental services, and other services such as Love by Tree or QR code of the tree. It also provides linkage to the Umang portal of the Government of India. We also provide online medical store and stock positioning, and also e-hospital services.
We have also
and
established a cybersecurity agency.
And e-waste facilities. In the government to business category, we provide business plan approval, online mutation of the property, online health trade licensing, bill tracking system, because all the bills are paid electronically in the NDMC. So whenever a contractor submits any bill for the payment, it is tracked electronically so as to ensure that the payment is made in time. And then online road cutting permission, because various permissions are required for many a time for cutting the road to lay the services. In the government to employee category, we provide services electronically to the pensioners. We provide serving employees their pay slips, the form number 16.
Everybody's trying to go digital.
General Provident Fund statement. Then also we provide online vigilance clearance to employees for various purposes. We are also providing GIS mapping for purpose of attendance of the employees. In addition to this, we provide sometimes short-term services such as yoga day registration, Swachh Sarvekshan pledge, Swachh Sarvekshan survey, school admission registration, and to fill up the vacancies of junior resident and senior residents in our hospitals. I would now come to the key initiatives which were taken by the NDMC to ensure the seamless delivery of services without human interface. First of this was the birth and death certificate. This service has been created by NDMC so as to have a QR code embedded into the certificate that is provided, which can verify the genuineness of the certificate. And this also provides that if a person, because when a child is born, the parents have not decided about its name. So this name can be added by the parents later by using the Aadhaar details on the portal or on the mobile application. So this has resulted in tremendous benefit to the public. A service which used to take about 7 to 10 days now takes about 5 minutes only. Then we have another service called for the purpose of providing electricity and water connection. This process has been totally digitized. and the applications can be made online. The applicant doesn't have to go to any individual or any officer for getting this connection. The internal approvals also in NDMC are also made available online, and the physical interface has been totally eliminated in the NDMC. NDMC as a part, because it provides various services to the citizens. For the payment of these services, we have set up various payment online systems such as UPI, enable Bharat QR code, Bharat Bill Pay System, NEFT, RTGS, and debit and credit card. And this has provided a hassle-free online payment to the citizens and residents of the NDMC area. NDMC also has Bharat Ghars and has other services as Bharat Ghars and water tankers that we supply in case of disruption in the water supply. We have community centers and different NDMC venue for public events. All this have been made, their booking has been made online without any human interface. Person can book these facilities, make payment for these services, and get the booking receipt of these facilities. So there's no requirement to visit any NDMC office or to deal with any official. NDMC also has hospital, dispensaries, polyclinic, Ayush centers, and also a central medical store. Now the person who desires to use this facility can register online. He doesn't have to wait at the hospital counter to register himself. He can register online and go to the hospital and meet the concerned doctor or avail the desired facility, or whether it is a pathological test or other such tests which are to be carried out. And then he also knows the medicines which are prescribed by the doctor, whether they are available in the central medical store. So he doesn't have to depend on word of the employee who's there, whether these medicines are available or not. And it saves him large amount of time standing in the queue for registration at the hospital. We have also created a special geographical information system, which has at the moment 256 layers. And this provides a tremendous set of information for NDMC to plan its services, and also based on the citizen input, we can actually create a heat map where the cases of dengue or malaria are coming up, and accordingly take preventive action in terms of spraying or enhanced cleanliness in that area. This has been a very valuable tool in combating seasonal issues in NDMC. When we have a public toilet unit, we have implemented a feedback system in all the public toilet units, which are over 350 in number. And there is a mechanism by which complaint can be raised by either scanning a QR code or a physical system which is installed there. And these complaints are then thereafter addressed in a time-bound manner by the NDMC staff. And any successive 3 complaints which are raised results in immediate action to redress the issue. NDMC also started single line sign-on facility for all the services that it renders. Earlier, the system used to be that individual had to log on to each service separately, and now with a single sign-on, NDMC services can be availed by a citizen seamlessly without having to log on to each individual services. We also have started the e-waste collection system. This is a unique system whereby the resident of the NDMC area, they want to dispose of their e-waste, can log on to the NDMC site or the mobile application and declare the e-waste that they want to dispose of. And there is a value assigned to this e-waste. Accordingly, the concessionaire who has been given this charge of collecting the e-waste and its proper disposal will come to the house, collect these items, and the value of this item will be credited electronically into the account of the person who's disposing of this e-waste. So it's a system by which the resident doesn't have to go anywhere. He just have to declare the e-waste that he wants to dispose of. They are picked up from the residence and then disposed of scientifically by the operator. To achieve all these things, the back-end digitization of NDMC had to be done. So NDMC is now totally onto the e-office. There is no paper processing in the NDMC. The entire data of the NDMC has been digitized, and the all processing, internal processing of the file is on the e-office mode. we have also implemented eSparrow, which is actually a annual performance appraisal system, whereby the appraisal is of the officers and staff is done electronically, and then we have also implemented human resource management system, which facilitate proper monitoring of the manpower planning, recruitment, posting, promotions, and the attendance also has been made online of all the staff. In the year 2019, we also established Integrated Command and Control Center. It's a nodal point of all the services that are made available by the NDMC, and it is located headquarters of the building. It has greatly facilitated in streamlining all the services and have a complete monitoring of the services which are being rendered by the NDMC. Now I'll come to the mobile application for citizen-centered services, that's 311. 311 is an open protocol for non-emergency services response used worldwide, and it was required in NDMC to redress civic grievances, information dissemination, and permanent solution to recurring problems. And actually, it's basically a smart vision for smart governance. NDMC 311 citizen interface has two components. One component is a citizen corner, where citizen can raise the complaints related to the municipal function that is of concern to them, and second, and also the booking of the citizen facilities, and also pay for all the services, including utilities. And this includes Bharatgar swimming pool, inoculation slot booking, birth and death certificate, nearest parking space, navigation to location in NDMC, and pay for all utilities, taxes, and services. The second component of 311 is the officer's corner, which has a unified dashboard of all the complaints raised, and also to track the complaints resolution. And actually, it is for the governance of the officers and the responsible person who have to address these services. And this helps in assigning the responsibilities. Attendance system also is monitored through this, and feature generates. This also allows the implementing officers to generate mobile challans for the people who are not complying with the municipal bylaws, and also it is compliant with the central registry. This has resulted in a better administration of various services of NDMC, and NDMC is providing over 40 municipal such services through this system. And this NDMC 311 app acts as a citizen-centric application as one-stop solution to all the citizen-centric grievances. And this leads to integration of officer portal for effective complaint redressal and seamless integration of interface of Swachh Bharat, Umang, etc. for effective and timely redressal of the grievances. The impact of 311 has been that number of users has increased, as you can see, from 2000, up to 2021, it has reached up to 60,000. The e-office and other such backward integration has resulted in the reduction in the use of stationery in the office, and number of transactions has increased tremendously, and physical transactions have gone down tremendously. Now I come to benefit of various IT-based initiatives. It has empowered the resident and the citizens of the NDMC area. And earlier the municipality used to suffer from slew of issues, including lack of transparency, ineffective governance, poor accountability of resident grievances. And after the implementation of IT-based solution, resident is now empowered to demand public services in a transparent and efficient manner. It has led to improvement in services, and citizens enjoy better service and their needs are met faster and completely. It has given them convenience. The paperless processing provide constituents with on-demand access to application, information, and other services which would traditionally require a trip to the government office. By digitizing the operation, government can move efficiently, process claims, application, license requests, and resulting in a higher public satisfaction. Remote work and business continuity, even on the days when the government offices are closed. e-services continue to be delivered. One can submit applications also, enable employees to access crucial data from any location through any service, any device at any time. And it has, of course, cut costs. Digital document management eliminated cost of printing and mailing to the citizen. Online payment also reduces the processing cost. So these are the convenience which has cost, which is because of the IT initiatives. The other benefits are that all of the services in NDMC are now at the doorstep of citizen, can also be accessed through mobile on a single click. Citizen need not come to the NDMC offices for their work. Faster delivery services, number of citizen facility centers have been reduced from 5 to 2. Payment collection centers, which were located at different locations across NDMC area, can be permanently closed. Footfall at existing NDMC facilities has also been reduced to more than 50%. Transparency has increased, and so has the accountability because of it. This is some of the citizen feedback that I've put in this slide, and which essentially says that people are happy and contented and actually are very satisfied with the faceless delivery of the services. NDMC is also embarking upon adopting the new technology, and we have adopted the blockchain technology in our birth and death certificates registration. And this is a very safe technology. It is more secure, it is malware resistant, and it is trusted by both the parties. We have also started chatbot facilities on NDMC website, and this is now in operation now, and this will enable citizens to get a better response to their queries in a personalized manner with 24/7 availability. NDMC is also concerned about the cybersecurity issues when we go digital completely in our operations and citizen service delivery. So we have a robust system of IT security, and we are taking steps as per the cybersecurity policy to get ISO 27001 certification. NDMC to give lead to the other municipal organization has also established a common portal to share the best practices which are done by the NDMC, and also allows other municipality also to put up their best practices which can be documented and which can be shared with other municipalities. And this is an overarching objective to promote mutual learning for local bodies and delivery of municipal services and utilities for overall well-being of the population of the municipality. This is just steps which are which can be used to target seamless end-to-end delivery of services. The first step should be to identify the goals. Then what is needed is to build up the networking infrastructure. Then records have to be digitized, and then applications have to be developed as per the needs of the various departments and services. And then it will require continuous upgradation of applications from the feedback from the citizen. Then to develop a mobile application for wider reach of the applications and implement latest technological innovation. It is not that the NDMC could implement all this without having any challenges within the organization and its constituents. These are some of the things that we have mentioned here which had to be met. They were challenged to us in implementing this this seamless delivery of municipal services and digitization of municipal services. The biggest challenge was no change management. Having a strong change management culture is vital for any organization, and inertia to change is a major roadblock in any implementation of project. Then selection of software and technology, another important challenge. Driving adoption of new technology and processes, continuous evaluation of citizen needs, and this is more important, and because of the COVID pandemic situation, and in fact it accelerated this evaluation and citizen needs. Then lack of computer skills, because large population or employees is still of the time when they were not computer literate or savvy. So that was another challenge that we had to meet. So this is how the NDMC could achieve the seamless delivery of municipal services in a digital manner. Thank you.
On behalf of Government of India, let me thank Sri Dharmendra, Chief Secretary, Government of Arunachal Pradesh, for bringing forth so many innovations and benefiting millions of Delhi's citizens. We have about 600 district collectors in today's web room, which is almost 90% of the total districts of India are participating in today's event. So you may kindly take note of the several points that he has said in addition to the services that have been provided, cyber security measures that are there, citizen feedback forms, the use of emerging technologies, the presentation in terms of the sheer impact in terms of scaling up within a very short period of time, the benefits that IT-enabled services have brought forth, and also the sequencing in terms of how this entire project was formulated. He has also brought forth the challenges faced by NDMC. Any kind of reform is not easy, and Dharmendra has succeeded in bringing forth this massive change management in Delhi, which is benefiting millions of Delhi's citizens. So we would request this, we would recommend this project very strongly for replication in all major cities and major municipalities of India. Thank you very much, Dharmendra.
If I can add, the NDMC can provide this software to any municipality who wants to put in this system there, free of cost.
I think that would be a wonderful initiative. If anybody wishes to replicate it in their district headquarters or in any of their municipal bodies, you may kindly send us a request. We will pass it on to NDMC for replication at the earliest. And I notice that there are many technocrats who are attending this webinar today. If you have any similar requests for replication, you may please send us, and Dharmendra is always there to help you out as a guide and advisor. Let me also welcome, before I invite the second speaker, the Director General, Indian Institute of Public Administration, Dr. S.N. Tripathi ji has just joined us. Thank you, sir, for joining us on this occasion. As also the Registrar General of IAPA, Sri Amitabh Ranjan ji has joined, and our Joint Secretary, Srimati Jaya Dubey ji is also here. So I'll now invite our second speaker, Srimati Deepti Aditya Kanade, one of the young officers who is a high achiever in terms of technocracy and adopting, bringing technology to the people. And when I saw the Seva Sindhu application, I was quite fascinated by the sheer gamut of services it provided. May I invite Deepti ji to kindly make her presentation. Thank you for joining us today.
Thank you so much, sir. Respected V. Srinivas, sir. His Excellency Lokum Yin, Permanent Secretary, Public Service Division, Government of Singapore, other dignitaries from Government of Singapore and Government of India, and all the participants in today's webinar, a very good afternoon to all of you. I thank the Department of Administrative Reforms and Public Grievances, Government of India, for this opportunity to speak on Seva Sindhu before all of you. Is my presentation visible, sir?
Kindly go to the, yes, the slideshow is seen. Please go ahead. Yes. We can see you. Please continue.
Thank you, sir. Seva Sindhu, as the name suggests, it is an ocean of services. It's an ambitious initiative launched by Government of Karnataka to offer government services to citizens in a cashless, paperless, faceless manner. And in turn reducing the turnaround time and eliminating physical visits to government offices. What started in 2018 with merely 35 services from 6 departments has today evolved into a full-fledged single window agency of Government of Karnataka and is offering more than 850 services from across 80 departments and other government boards and corporations, which is highest in the country. Seva Sindhu runs on the Service Plus platform of NIC and offers a complete end-to-end solution in service delivery arena, starting from raising of applications, which would typically involve filling up of forms, attaching certain documentation, payment of fees, tracking of applications, and then final delivery of the output. The entire processing, back-end processing by various government officials also happens completely in a digital manner, making it an entirely digital solution end-to-end. I'm happy to state that since inception, Seva Sindhu has clocked in more than 2.6 crore or 26 million transactions. Just to put things in perspective, Karnataka, which is the 9th largest state in India by population, has a population of around 66 million as per recently published government data. How Seva Sindhu adds value to the citizen's life? In a nutshell, I would say Seva Sindhu addresses 3 important impediments that we generally face in any service delivery mechanism, namely the information deficit, the uncertainty associated, and the third being the digital divide. To understand this better, let's take a typical government office setup, which is delivering its services manually. And I'm not talking about any ancient era. Even today, there are departments and governments which offer services in a manual way, both in developing as well as developed world. So the first issue starts with locating which is your concerned jurisdictional office. It is quite possible that if my house is on one side of the street, my jurisdictional office is different than if I were located on the other side of the street. Then the information about where to get the application form, what documentation to attach, how much fees I'm supposed to pay is not very easily forthcoming. Third thing is, if I'm lucky enough to get information about all of this from a neighbor who recently has taken these services, I will still have to physically travel to my jurisdictional office for submission of this form. If I am a office goer living in a city, I have to take a day off. Worse, if I am a daily wage laborer, I have to let go of my 1 day's wages and also spend substantial time and money on traveling to a nearby taluka place, which could be around 40 to 50 kilometers from my native place. If I reach the office, I have to go in the office hours and on only working days. Any public holiday, the offices would generally be closed. If I go there, in all probability, there may not be a service, a dedicated counter to receive my application, scan and see if it is complete in all respects, or to see, in case of clearing my doubts. I may have to navigate maze of corridors to locate a desk where I'm supposed to submit my application. The concerned person may not be available because he may be busy in a meeting or may have taken a day off. Even after submitting my application, I'm still very uncertain about the fate of what happens next, because I will not know if, in case the processing authorities seek any clarification or additional documentation, how will they reach me? Or, once the application is either accepted or rejected, how will I come to know? Once, how many days it might take. So this entire process is, fraught with a lot of uncertainty, and more often it does not make it a very pleasant experience to avail government services. Third, as I mentioned, is issue of digital divide, which I will subsequently, in my other slides, I will talk about it more. Now, how Seva Sindhu helps in addressing these issues? Talking about information deficit, Seva Sindhu has a very detailed information disclosure about each service on the portal, which includes the overview of the service, details about eligibility, documentation, fees, and also the nearest location of any assisted service mode center. We also have a chatbot for 24/7 support for any citizen queries. And all these 850 services have been arranged on the portal in a very easy to locate fashion. Seva Sindhu is fully integrated with Aadhaar, which means it has Aadhaar-based authentication, eKYC, both OTP and biometric has been facilitated. All the payments of financial assistance are done through Aadhaar as financial address. Seva Sindhu also is integrated with eSign and DigiLocker. eSign helps in authentication of both the applicant as well as the officials approving or processing the thing. And DigiLocker, all the documentation, the service delivery, the certificates, output documents are stored in your DigiLocker in a soft copy so that they are always available. All the certificates or documents that are delivered using Seva Sindhu have a digitally signed QR code for enhanced security and has helped in case of complaints in tracking down the things. Seva Sindhu also is integrated with Sakala, which is mechanism under the Guarantee of Citizen Services Delivery Act of Government of Karnataka, and ensures timely delivery of services as per the stipulated timelines for each service. There is also an option for submission of online appeal in case of delayed service delivery. Another interesting feature of Seva Sindhu is real-time SMS and email notification on changes to your application status, such as successful payment, submission of application, either approval of rejection of the same, and final delivery of output certificate. There is also a feature which enables the processing authorities in case they seek any additional clarification or information from the applicant. The real-time SMS and email alerts are sent to the applicants so as to upload additional information. As I have mentioned earlier, it has 100% digital payment, both for application fees as well as payment of financial assistance using Aadhaar as a financial address. Seva Sindhu is a very flexible platform. It supports both end-to-end development as well as integrations. So for departments who have been offering their services in a completely manual fashion and would like or would prefer development of an entirely digital solution from scratch, Seva Sindhu supports all such onboarding of services. And for departments who already have their own IT systems, Seva Sindhu can easily integrate with them and onboard such services as well. I briefly mentioned about issue of locating your jurisdictional office. Seva Sindhu is also integrated with KGIS, that's Karnataka Geographical Information System, for automatic geolocation detection of the user. It offers 3 modes. In the first mode, using the IP address of your computer, KGIS fetches the details of your ward or Gram Panchayat and uses this information to route the application to the correct processing authority. Second option is, suppose you're working in Bangalore and are a native of Dharwad or Gulbarga and you want to apply for the services of the local authorities, then you can select the location on the map, and again the system will fetch the required details and send the application to the correct processing authority. Third option is the manual option of filling the entire data by the user is also available. This slide gives a bird's eye view of sectoral coverage. As you can see, it covers the entire gamut of all the sectors, be it health, be it education, be it industry or farmer-centric services, and also covers all probable user profiles such as senior citizens, labor, women, youth, and the likes. The figures in blue indicate the number of transactions that have taken place in Seva Sindhu in each of these categories. This slide provides a snapshot of how things have progressed since inception of Seva Sindhu in March 2018. The yellow line indicates the number of services at any given point in time, and the blue line indicates the number of transactions that have taken place on Seva Sindhu. This provides a snapshot of the deployment architecture of Seva Sindhu. Seva Sindhu is hosted in state-of-the-art Karnataka State Data Center, which is a Tier 3 data center having 99.98% uptime. On the left-hand side, you can see an array of external systems with which Seva Sindhu is integrated. and is able to offer a much better user experience on account of that. Currently, Seva Sindhu easily supports more than 1 lakh applications in a day and has been able to deliver timely services as per the Sakala mandate. This provides a typical process of onboarding of government services and adheres to all the IT industry protocols which have been prescribed, starting from requirement gathering, sign off on the requirements, then actual configurations, internal testing, UAT, and the final go live. I would like to mention here that Seva Sindhu works very closely with the concerned stakeholder departments to understand their requirements, and we also try and bring in an element of government process re-engineering when we are trying to go digital, which further enhances the user experience. In the overall citizen service delivery arena, Seva Sindhu is ably assisted by the assisted delivery of assisted delivery channels, which are Grama 1 in the rural areas, Janasevaka, which is the door delivery of citizen services, and Bangalore 1 and Karnataka 1, which function in the urban areas. These are the centers set up by Government of Karnataka in a public-private partnership mode, where government provides branding and technology, and operations partners are selected who set up these centers on franchisee modes. So in the process, the government practically does not spend any money on implementation of these centers, but in fact has been generating revenue through revenue sharing model with the operations partner by sharing of service charges. I would briefly touch upon all these three modes one by one. Grama 1 is envisaged to be a single point assistance center for all citizen-centric activities at the village level, which not only includes delivery of government services, but also banking services, skill upgradation services, etc. Grama 1 was launched on Republic Day this year, that is January 26, 2022, and is now operational in all 31 districts of the state with more than 7,000 centers offering all 850 plus services. I'm happy to state that the response has really been very encouraging. And since 26th January, more than 82 lakh or 8 million applications have already been clocked in. The services are becoming popular because there is naturally saving on opportunity cost. I do not have to travel, like 30, 40 kilometers, let go of my day's wages. It has generated employment for rural youth, provides accountability and transparency in service delivery, is extremely convenient because these centers work from 8 a.m. in the morning to 8 p.m. and even work on all government holidays. And of course, additional bouquet of services such as financial inclusion have also been clubbed together. This is how the typical Grama 1 centers look like. As you can see, all the required hardware support has been provided. Talking about Janasevaka, this is again a very innovative citizen-centric initiative introduced by Government of Karnataka, where citizens can avail services from the comfort of their homes. This was launched last year on 1st of November in Bangalore and has been steadily gaining popularity. This is how a typical Janasevaka workflow takes place. The citizen can book a slot either by calling a call center or using a mobile app or going on the Janasevaka portal. There, all the documentation required, prescribed has already been provided. So once the citizen ensures that he has all the documentation, he is further, asked to book a particular slot. In the given slot, a representative comes to their homes who is fully equipped with all the necessary hardware such as scanners, printers, fingerprint processors, laptops, etc. So he's able to raise application, scan all the documents if any required, and realize that application by taking pre-prescribed fees. As per the Sakala mandate, after the certain service document is ready, then the Janasevaka again goes back to the citizen's house to deliver these services. As we can see, we have had an overwhelming response from senior citizens, from physically challenged persons, or persons who are bedridden, who have really were otherwise left out of the mainstream to avail these services. Coming to Bangalore 1 and Karnataka 1, what Grama 1 is for rural areas, Bangalore 1 and Karnataka 1 is for urban areas. This initiative was started way back in 2003 with a pilot launch as Bangalore 1 and has now been extended to almost all the urban local bodies in the state. This is how a typical Karnataka 1 center would look like. This shows a typical operations management and training workflow for Seva Sindhu, both online as well as for the assisted modes of delivery, and is rigorously followed to ensure that we maintain the standard of delivery. Coming to certain additional features of Seva Sindhu, it is an extremely versatile and agile platform and has really helped in onboarding of emergency services during crisis, especially during COVID-19 crisis. Seva Sindhu is already integrated with other government data sources, in horticulture and agriculture departments, in education departments, in revenue departments. This integration has ensured that most of the fields that one is otherwise required to fill in the form get auto-populated using verified data, which is already fetched from these other data sources. This really has enhanced the user experience because it has reduced the number of documents that one has to upload and also the data entry part. Since this is also integrated with Kutumba, which is an entitlement management and integrated social information system of Government of Karnataka, which acts as a social registry and integrated beneficiary management system on which more than 55 million citizens have already been enrolled. As I mentioned earlier, this is integrated with Sakala, so helps in timely delivery of services. Integrated with DBT platform for payments using Aadhaar as financial address. And because of all of these things, because the information, most of the information reaches processing authority in an already verified fashion, the time for processing of these applications by government authorities also has substantially come down. Seva Sindhu is compliant with all the important mandates such as W3C, guidelines for Indian government websites, and national e-governance service delivery assessment mechanism. Seva Sindhu is a citizen-friendly portal in terms of it offers all the services, 850 plus, on a single platform. It also includes the applications for beneficiary schemes of the government. Seva Sindhu is integrated with the centralized grievance redressal system and has a detailed feedback mechanism available on the portal. It is also integrated with Mahiti Karnaja, which is another portal of Government of Karnataka for proactive information dissemination. I have already mentioned about the SMS and email notification as well as chatbot. Government process reengineering also has been an important feature. When we have moved from manual to digital, this has been one of the pivotal points, that has been stressed upon. And comprehensive MIS with dashboards is given at all levels for the decision makers to monitor. All these various best practices such as stakeholder consultation and planning, government process reengineering, universal access both online and through assisted delivery channels, digital payments, and integration with important databases across government of Karnataka has really helped us in taking Seva Sindhu, to further improve the service delivery levels in Seva Sindhu. Coming to way forward, we are at about 85% in terms of saturation in digital delivery space for both services and beneficiary schemes. So the next target is to achieve 100% saturation in a stipulated time period. We have started use of emerging technologies, but there is a long way to go. We are aiming at big data, blockchain, artificial intelligence, and machine learning to further the service delivery mandate of Seva Sindhu. Another interesting experiment which was done in Government of Karnataka is entitlement-based delivery of services. Generally, the government would announce a scheme and would expect the eligible citizens to apply for it. Since Seva Sindhu is already integrated with most of the other databases, information on almost 90 to 95% of eligible citizens is generally available, it has been seen. And an experiment was conducted for auto disbursal of scholarships to students based on their eligibility, and the results have been very, very encouraging. We are also working on the single sign-on for seamless movement across various government platforms. And the last point is about expansion of assisted modes of service delivery to all parts of the state. In the first phase, Janasevaka is expected to be expanded to 10 city corporations in the state, Gramavan centers in few remaining Gram Panchayats, and Bangalore one or Karnataka one to all other urban local bodies. Seva Sindhu has been a recipient of various awards and recognitions, the most prestigious being the Prime Minister's Award for Excellence in Public Administration for the year 21 for seamless end-to-end delivery of citizen services without human intervention. Thank you.
Let me thank Srimati Deepthi Aditya Kanade for making such a substantive presentation. I think doorstep delivery of public services is the next generation administrative reform in terms of governance, and she has successfully taken forward about 80 services as part of the doorstep delivery of services. In addition, district collectors may have noted that the Seva Sindhu is providing more than 800 services online. So it is a phenomenal system, and you must consider visiting this portal for replication in all districts of India. It is also my great privilege to host the Director General of the Indian Institute of Public Administration, Dr. S.N. Tripathi ji, an officer of 1985 batch, formerly Secretary to Government of India in the Ministry of Parliamentary Affairs, who is the knowledge partner to the Government of India in terms of formulating our Vision India 2047. And he is the man who has been formulating how the digitalization and digital transformation of government services is to be taken up. So I'll request Dr. S.N. Tripathi ji for his concluding remarks, and thereafter invite Professor Poonam Singh for the vote of thanks. Dr. S.N. Tripathi ji.
Good afternoon, friends. Respected Secretary and my friend, Mr. B. Srinivas ji, His Excellency, Permanent Secretary, Government of Singapore, CEO, Civil Services College, with whom we had interaction. And friend, this team of Singapore consists of one officer, which I would like to highlight. He is a Chief Experience Officer. Generally, government officer will have a financial advisor and an audit officer and a police officer. But the team Singapore is carrying with him a Chief Experience Officer. When I asked him what you do, maybe he was doing much more than what he told. But he says, my job is to replicate how the citizen experiences a digital service, and that feedback he gives is permanently to the Permanent Secretary, who advises to the Prime Minister. So friends, this is how Singapore is delivering so many services, keeping citizen centricity as the cornerstone. And friends, we are happy that at least in Government of India, If you take up Umang, it has become a platform by itself, sir. 28,000 digitally delivered services are available at one platform, being delivered by 28 states and 9 union territories, and delivered by our young collectors, whom some of you heard. 2008 batch Deepti ji, 1989 batch Dharmendra ji, and many more such applications which have been recognized by DRPG. We have also taken, one thing I think we must learn from Singapore is that Service SG and Life SG, they have taken the model of life stage-wise services. In India, we adopt that ये service हम देते हैं, इसको लेना और ले लो, नहीं तो you forget it. But they are talking the life service, marriage level, education level, even at the level of aging level. So what are the services that a citizen need? So all those things are clubbed together and being delivered online. So it's a very good learning. But you must be happy to understand how even the birth certificate by NDMC is being issued in just within 5 minutes. And sir, you are issuing 9,000 birth certificate in a year. They are issuing 1,000 certificate a month. Maybe we would not like you to compete there, but we certainly like to compete in technology, that what was happening in 10 days is happening in 5 minutes. And so very good lessons to be learned. I think Seva, Sindhu, Karnataka has been a phenomenal success. Karnataka has been the leading light of IT innovation. We in Orissa always model ourselves on Karnataka model. But now many states are coming. So the pride #1 position of Karnataka is also under threat from even states like Arunachal Pradesh, Orissa, Rajasthan, and many other states. And know it, I mean, I can't avoid mentioning Gujarat, which is again becoming the leading light of digital services. But sir, one thing I would like to certainly highlight what the Indian model is, our Indian approach has been, that we are thinking what would be the face of government in next 25 years. So we are providing visioning exercise to most of the ministries whose job is to bring citizen and government closer. In fact, we were paid by citizen to become the government. Now we want to make the same citizen and government bringing closer. And my 700 colleagues who have joined from all over country, they are part of that citizen delivery. We recognize their good achievements. In fact, the DRPG should be complemented for that, not only cherry picking, but hand holding them. And this year, as per advice of the Prime Minister, which I must compliment the department, they are sharing the experience not only once, but at recurring occasion. In fact, some of the achievers, I have myself heard them 3 times. So I remember them by slide. So that is how we want to share the experience of good people, because the circumstances under which collectors work and our DMs work, they are totally different from what a city state like Singapore or maybe in the NDMC area like Delhi works. But we are doing, I mean, I can't say that we are doing wonderful work, but we are second to none in using digital technology. And today, 311 can become 911. I mean, they can become 3 times better. And the approach that we follow is nudging the bureaucrat to deliver better. And there is no other way than to give them training and capacity building. And I am happy that IAPH has been associated very actively by DRPG. And I have no words to thank the ministry and the department and the whole team of ARPG, who makes no point in giving respect to IAPA. I don't know whether we deserve it, but we certainly recognize your acknowledgement. Thank you very much.
So let me thank our distinguished Director General IAPA and our 2 participants who have spoken today. Replication is a very important aspect of good governance, and let me personally reiterate the Honorable Prime Minister's words that the National Good Governance webinar series are intended for massive dissemination of the best practices that India has, and the best practitioners and the highest meritocracy is to be presented in these fora. So we have tried to bring forth in today's webinar 2 highly successful initiatives, and we hope many of you would attempt to replicate them in your districts. May I now invite Professor Poonam Singh, the faculty in charge of NCGG, for delivering the vote of thanks.
Thank you, sir. Thank you so much. Namaskar and good afternoon to all.
नहीं ये ले जाओ माइक ले जाओ
Thank you so much, sir. Namaskar and good afternoon to all. First of all, I am delighted to propose a vote of thanks, especially for Mr. Loh Kung Yan, Permanent Secretary, Public Service Division, Prime Minister's Office, Ministry of Law, Government of Singapore. We are very, very grateful and thankful to you and all the delegates from Singapore, sir, as Singapore is known for the 100% good governance implementation. So thank you so much. You are here. It would be a great learning from the both countries, because we are also doing the very good, I think the very good work and services in our country and your country. So it will be a great initiatives for the learning from the both sides. And we are also very, very grateful and thankful to Sri V. Srinivas, sir. We have worked a very, I can't explain in words, under your dynamic leadership, sir. We are always very thankful and grateful, and we are also hope that you will be giving the guidance from your side always. Thank you so much, sir. We are very, very thankful to the S.N. Tripathi, sir. You are a very great orator, we also know, and we are very grateful to listen your, I think, the speech. And now we have a Director General of National Center for Good Governance, Sri Bharat Lalji, sir. During the 3 and 4 days, we are very, very highly benefited from your great, I think, the opinion and your guidance and motivation, sir. And the officers from the DRPG, the Madam Zaya Dubeji and Rajput, sir, and all the officials. And also, we are very, very kind and grateful to all the audience. I would like to mention in one sentence, the officers of from the urban local bodies in states and union territories, officers of nationalized banks, officers of customs, central excise and income tax, officers of the Office of Registrars of Births and Deaths, information technology secretaries and administrative reform secretaries of states and UTs, heads of rights to service commissions, district collectors of all states and UTs, trainees from Indian Institute of Public Administration, Lal Bahadur Shastri National Academy of Administration, Institution of Secretariat Training and Management, and Administrative Training Institute of State UTs, officers from Department and DRPG, my colleagues from NCGG, and the IT expert, especially for Akash. We are very, very thankful to you. Basically, the aim of this webinar is to highlight the best practices and award-winning achievements to create a precedence for others to replicate. Thank you so much, all of you. I would like to give a great thank to all of you for nice presence and great presence. Thank you so much. Have a nice day. Yes, sir. Yeah, next webinar is 28th, and we will organize this. And I think this would be, I think, great learning experience from the district collectors also. We would request you to replicate the best practices. They can, I think, approach the direct to the states and the concerned officers who have done great process. Thank you so much. Have a nice day.